everyone, Dr. Mike here. I wanted to talk a little bit today about type 2 diabetes. Type 2 diabetes is different from type 1 diabetes in that type 1 diabetes you're born with. You're born with the pancreas not able to produce enough insulin to break down the blood sugar in your body. So as that blood sugar increases, it causes problems. And so when you have type 1 diabetes, you're usually on insulin at a very, very young age. You're giving yourself injections, or now they have the insulin pumps that you can use. Type 2 diabetes is very, very different. Type 2 diabetes, we cause ourselves most of the time. Type 2 diabetes comes from obesity. Our diets here in the United States are terrible. The obesity problem in the United States is terrible. Ever since the 1970s, where the low-fat revolution started, and they started taking fat out of food and adding more sugar to food, it's become a mess. And type 2 diabetes is very, very rampant, and it's getting worse and worse each year. It's a very controllable disease. It's a very manageable disease. But most importantly, it's a very avoidable disease. We've got to take the weight off, guys. That's the main thing. We eat ourselves into diabetes by eating too much sugar, white flour, those types of things. We've got to increase the protein in our diet. We've got to increase the good fats in our diet. Get rid of the sugar, get rid of the white flour, the bread, and start eating in a more manageable way to take the weight off so we can get rid of the diabetes. Portion size, we have to eat less. It's important. If we can eat less calories, and then cut down on the sugar and the bread, diabetes again will go away and is very manageable. It's a disease that you can avoid, but it's a dangerous disease as we get older. It can cause so many things later on in life, from neuropathy in your legs and feet to some people actually have to amputate their legs and feet because it slows the healing of sores and wounds down. It's a very dangerous disease, guys, and all I'm trying to say is we can avoid it. There may be a small genetic component where people who had it in their family are more predisposed to it and aren't necessarily overweight, but the majority of people with type 2 diabetes are very, very overweight. And over a period of time, your body just can't handle it. It starts producing less insulin, and then the problems begin. So anyways, it's a disease I want to talk about. It's a disease that's manageable. It's a disease that's avoidable. Let's change our diets and start making healthy choices and make the rest of our life that much better. So have a great afternoon, guys.